Hi, I'm Dr. Adam Green. I'm a pediatric brain tumor physician scientist at Children's Hospital Colorado and the University of Colorado. I wanted to talk a little bit about the recent work my lab has been doing in DIPG research. We work on a lot of different projects in DIPG, but with our recent Cure Starts Now grant, we wanted to look at some really fundamental questions about how DIPG is treated currently and how we can improve that going forward. So the current standard of care treatment for DIPG is focal radiation just to the pons. And we know that it's transiently effective, but that the tumor always comes back. In terms of chemotherapy, we know that in terms of oral and IV chemotherapy, that despite hundreds of clinical trials, these have really never shown a survival benefit in DIPG. But the convection-enhanced delivery, in which catheters are inserted directly into the tumor for direct chemotherapy infusion, is pretty early in clinical trials, but there are some early indications that it may be efficacious. And so the concern is that with these focal treatment approaches, that DIPG eventually becomes metastatic and spreads elsewhere in the brain and spinal cord. And at that point, focal treatment isn't enough. So in terms of radiation, we were interested to see whether we could give craniospinal radiation, in which we radiate the entire brain and spinal cord and minimize that metastatic spread. So we used our patient-derived DIPG mouse models and set up an experiment in which some of the mouse got craniospinal radiation, CSI, some of the mice got focal radiation just to the pons, and then we looked at metastatic disease both by imaging and on pathology by looking at the brains and spinal cords under a microscope after the mice died. And we showed that we were really able to minimize the amount of metastatic disease in the mice who got CSI compared to focal radiation alone. In terms of chemotherapy, the question we were interested in answering is it maybe the case that all of these clinical trials in DIPG of systemic chemotherapy have failed because no chemotherapy can actually reach DIPG tissue adequately to induce a response? And so for this question, in addition to our mouse work, we also set up a clinical trial in which newly diagnosed DIPG patients get one dose of an IV chemotherapy called gemcitabine, and then they undergo their standard of care biopsy, and we're able to measure the concentration of the drug in the DIPG tissue. And so we've enrolled 2 patients on the trial so far. And we also had some data from a similar adult trial that was run in a similar adult tumor called glioblastoma. And those patients got the same drug and had their resections of their tumor. And those scientists showed that gemcitabine was able to reach the adult glioblastoma tumors in concentrations adequately to induce response. And so when we looked at our data, we were really surprised to see that in DIPG, the gemcitabine also reached the DIPG tissue in adequate concentration to induce response and at the same level or higher than in the glioblastoma tumors in adults. We had some parallel mouse work that we did in which we looked at our mouse models and showed that whether the DIPGs had the defining H3K27M mutation or whether they were in the pons or the cortex, the gemcitabine was able to reach the mouse tumors adequately for a response as well. We then set up a mouse model of convection-enhanced delivery and used the same drug and showed that when we used convection-enhanced delivery, we were able to get about 50 times the concentration of that drug into the tumor versus the systemic delivery in mice when we controlled for the differences in dosing. And so now what we're working on going forward is combining these treatments. And so combining CED, systemic chemotherapy, and craniospinal radiation to see if we can control not only the focal disease in DIPG, but the metastatic spread as well, to really meaningfully improve survival for DIPG patients going forward. So thank you for watching. Thank you for your support of the DIPG research community, and thank you to the Cure Starts Now, without whom we really couldn't have done this work.